is Madison. I'm a nursing student. I'm going to be performing a neurological assessment on you today, if that's okay.
Yep.
Can I get your name and date of birth?
Parratt, September 10th, 1996.
Do you have any allergies?
Nope.
Okay, now for this assessment, I'm just going to be assessing your hearing, your vision, asking you a few questions. You're going to be performing a few little tasks. So if you feel any pain or discomfort, just let me know. Okay. Patient is erect, sitting erect with good posture, no signs of pain or discomfort, appears to have good hygiene, appears stated age, no facial drooping noted, and appears to be alert and oriented. I'm just going to ask you a few questions. Have you been experiencing any dizziness, headaches, loss of consciousness?
Nope.
No? Have you ever had a concussion or a head injury where you blacked out? No? Okay. Do you smoke?
Nope.
Or drink?
A little.
What's a little? Like how often?
Like once a week.
How many drinks?
Like 3.
Okay. And then do you wear a seatbelt in the car? And do you wear a helmet when you go biking?
Mm-hmm.
And then has anyone ever told you have high blood pressure?
Nope.
No? Okay. And then do you have any family history of high blood pressure, Parkinson's disease, seizures, diabetes, anything like that? No? Okay, now I'm going to start my assessment. Okay. Do you know why you're here today?
Yep, for a neurological assessment.
And do you know where you are?
Hospital.
And do you know the date?
April 8th.
And can you state your full name?
Parratt.
Okay. Patient is alert and oriented. Behavior is appropriate for the situation. And facial expression is neutral. Okay, and then can I have you grade your pain? 0 being no pain at all to 10 being like you broke your leg, kind of pain?
0.
Okay. Patient states pain is 0, no grimacing or guarding. But if he did say he had pain, I would go through old cards with him. Now I'm going to assess your cranial nerves. Okay, so your 7th cranial nerve, which is your facial nerve, I'm just going to have you puff out your cheeks, raise your eyebrows, smile. Facial movements are smooth and symmetrical, indicating a grossly intact facial nerve. Your 2nd facial nerve is your optic nerve, so I'm just going to have you read this top sentence right here.
For my family, my parents Betsy and Floyd, their spouses Terry and Beverly.
Thank you. Optic nerve is grossly intact. And then so for your 3rd, 4th, and 6th cranial nerve, that's your oculomotor, trochlear, and abducens. I'm just going to have you follow my finger. Don't move your head, just follow me with your eyes. Okay. Pupils are equal, round, and reactive. And then eye movements were smooth and rhythmic. No nystagmus noted, so all 3 nerves are grossly intact. And then your 5th cranial nerve is your trigeminal nerve, so I'm just going to have you close your eyes, and I'm going to sweep a cotton ball across your face, and I'm just going to have you tell me where you feel the cotton ball being swiped.
Mm-hmm. Forehead, cheek, cheek, chin, forehead, chin.
Okay, trigeminal nerve is grossly intact. And then your 8th cranial nerve is your vestibulocochlear nerve. So I'm just going to have you cover one ear. Can you hear that?
Mm-hmm.
Okay, other ear. Can you hear that?
Mm-hmm.
Okay. And then your cranial nerves 9 and 10 are your glossopharyngeal and vagus nerve. So I'm just going to have you open up your mouth and say ah.
Ah.
One more time.
Ah.
Okay. Uvula and soft palate are midline. And move upwards when saying ah. And then your 12th cranial nerve is your hypoglossal nerve. And so for that, I'm just going to have you stick out your tongue. Move side to side. Okay. And then can you say light, tight, and dynamite?
Light, tight, and dynamite.
Okay. Hypoglossal nerve is grossly intact, tongue is midline, and then your last nerve is your 11th nerve, which is your spinal accessory nerve. So I'm just gonna have you shrug your shoulders. And then can I have you move your face against my hand? Against my hand. Okay. spinal accessory nerve is grossly intact. And that concludes my assessment today. Thank you. Let me know if you need anything.